Namaste and welcome to all of you for another wonderful evening. And we are part of this IWSP team, and our purpose is to bring those myths which are circulating, and a lot of our own fear is growing more than a year. Along with the pandemic, this is the heart attack becoming so rampant, so frequent, so sudden and we are witnessing, and there are a lot of misconceptions, a lot of myths around that. And we are very happy to bring Dr. Sushil Sharma on this platform today, who will try to bring a concept or the way to understand why it happens and how to prevent it. It is not that we'll be fearful.
I think Dr. Subrata went offline, so we would request Naresh. Would you take over?
Yeah. So, sorry, I think there is an internet issue, I believe, with Dr. Subrata.
Yeah.
As he said, we have one of the eminent doctor, Dr. Sushil Sharma, who is an Indian, lives in US, interventional cardiologist, board certified cardiac surgeon. So he has been part of this IWSP program with us almost about 1.5 years, and we have done about 6 different programs, and he's passionate about giving the scientific facts about our health, wellness, and importance of these details with scientific data backed by a lot of studies. So we thought this is a great opportunity for us to bring him to give a awareness session on sudden heart attacks, and he believes 100% is preventable. So he's going to take us another 30 minutes, close to 30 minutes time, and we'll please listen to him. And then we request, we are also doing a Facebook Live, and we'll also be providing the recording of this and circulate it to as many people as possible so that many people get to know the facts and, importance of understanding this. So Subrata sir is back. Subrata sir, I have taken on behalf of you. So we can welcome Dr. Sushil to continue, we'll take it up from here. Yes, Dr. Sushil, please.
Thank you, Subrataji. Thank you, Naresh, and thank you for the introduction. So let me share my screen with you. Okay, so some of you may recognize these luminaries, and just like you, they were professionals and famous in their own fields and achievers. And you know what happened to them. Now, to this list, you can add some more, Sourav Ganguly, our illustrious cricket captain, who ended up having 2 stents. Kapil Dev, my favorite, remember 1983 World Cup? Okay, so he also ended up having a heart attack and ending up having a stent. So what can we learn from what these people suffered? I think that the greatest lesson that we can learn from this is humility. We need to be humble and accept that if people like them, who are affluent, intelligent, illustrious, great achievers like you guys, they had all the resources available to them and they must have used them. And yet they were inflicted with a heart attack. Some survived, some did not, and suffered the consequences. And that's the lesson that I really want to learn. And that's a lesson that I learned from this. It happened to them and can happen to me. So full disclosure, right in the beginning, let me explain to you, and I will detail it out in the talk. My mother had a heart attack. My father had a heart attack. My brother had a heart attack. So it's not a question whether I will or will not have a heart attack. The question is, when will I have a heart attack? I know I will. And therefore, what it teaches us, listening to the tragic stories of these people, is that we should do everything to prevent that heart attack. And here I am with you today, promising you that heart attack is preventable. I am doing that in my own life. Through my personal experience, I know that I had an urgency to act, and I did. And I learned some things. I have been practicing interventional cardiology for the last 40 years. I've done over 10,000 angiograms. I've seen hundreds and thousands of patients with heart attack of different iterations, different types, mild, moderate, severe, fatal, tragic, all kinds of heart attacks. And by taking care of them, learning the science, learning the facts, I have come up with some methodology, which is called Integrated Wellness Science and Practice, and a path, which I call Dash to Wellness, which has certain specific practices that if you practice, you can prevent heart attack. And I follow it, and I want to share with you, and I want to benefit from you. Why? Because I do not want you to suffer a heart attack like these people suffered. Okay, so 50% heart attacks are silent. Now, a lot of you may know this. So what does that mean? What that means is half the time when you and I are having a heart attack, we will not know that we're having a heart attack. So typically, you all know heart attack, you must have seen in some commercials or videos or movies or personal life. You get sudden crushing severe chest pain that hits you in the middle of the chest. You get short of breath, you get diaphoretic, you get dizzy, you get lightheaded. You get this impending failure of dying and doom, and you know exactly what's going on. This is the worst thing you ever experienced in your life. What do? You call 911, you go to the emergency room, you go to hospital, and you know already that you're having a heart attack, and the doctor confirms that. Nice and well. Happens only half the time. Half the time, the heart attack is silent. You don't even know that you're having a heart attack. So before I go to silent, let me put in another 50% figure for you. Half the people that have heart attack actually do not reach the hospital. So you must be wondering, then what do hospitals do? Yes, half of you, 50% that reach the hospitals do a commendable job with angioplasty, stents, bypasses, and intensive care unit and monitoring. And they save 95% of those people that arrive in the hospital with heart attack. So they are doing an excellent job. But that 95% people that survive are from the 50% that reach the hospital. So half the people with heart attack die before they reach the hospital. And half are silent. So time to prevent is now. So what exactly do I mean by silent? Silent heart attack means that either there are no symptoms or symptoms are so minimal that you ignore them. You may have some chest discomfort, or it could be my indigestion, or they're completely unrecognizable symptoms. They have nothing to do with your chest and heart and all that, but in fact, you're having a heart attack. So we all need to know those symptoms so that we don't ignore them, because if we ignore them, we will not reach the hospital. So instead of pain, you could get pressure, you could get discomfort, or you get heaviness in your chest. If you get that, please don't ignore it. And you may have no pain in your chest. The pain actually may be in your arm, left traditionally, or maybe right, neck, back, jaw, or a little stomach pain, queasy in the stomach. Typically happens with certain type of heart attack. We call it inferior wall MI. Or you may just get nauseated and you may have cold sweats. You might think, oh, it must be something that I ate last night. I'm feeling a little discomfort, a little uncomfortable in my chest. I'm a little nauseated. I think it's going to go away. Let me take some Tums. Let me take some omeprazole. No, that could be the heart attack. Or you may just have difficulty in breathing. You may feel lightheaded, or you may feel dizzy. So see how non-specific these symptoms could be. So if you have risk factors that we will discuss, then none of these factors that I talked here, the symptoms that I talked here, you should ignore, because they could all be the symptoms of a silent heart attack. So you go to the emergency room with chest pain, tightness, heaviness, pressure in your chest, you're clutching your chest. That's classic heart attack. Even before you go, you know that you're having a heart attack. Well, the emergency room does an EKG. Some of you sitting in the audience who are doctors can realize this is impending doom. This is a massive anterior wall myocardial infarction. This EKG signifying that the main artery going to the front of the heart, the left anterior descending, is blocked up. The widowmaker, the one that closes and gives you a heart attack and you die. This is an urgency. Immediately, he will rush you to the cardiac catheterization lab. Why? Because this is what has happened to the inside of the artery. You see the red portion is the artery, yellow portion is the deposited cholesterol, and the big red blob right in the middle is blood clot. This artery is completely blocked. There is no circulation going through this artery, and your heart muscle is dying. If he does not open up your artery within 90 minutes, you end up with a heart attack. And he does an angiogram. You see the arrows, see how it's pinched there? That's where the blockage is. There's nothing flowing through that. And what he does, he puts a wire and a balloon, opens up, puts a stent, and you see the circulation is restored. And it's dramatic. If you're having a heart attack, you go to the emergency room, doctor puts a wire across and a balloon and a stent and opens up the artery. Right on the table, your pain goes away and you feel different. And this is the procedure that saves your lives, no doubt, when you go to the hospital. But if you don't, then you end up getting a heart attack. Now, see that dark spot there, right, that I've cut through the heart there? That is where the heart attack is, and that is where the blockage is. Now, this becomes a scar tissue. This part is damaged forever, right? But don't worry about it. It's not that end of the story. Ab ji ke kya karenge jab dil hi toot gaya, right? This heart's not broken. Heart has a tremendous capacity to compensate. Other areas of the heart take over. But the important thing then is you don't let it happen again, because if you let it happen again and again, then that heart attacks that pile up then lead to heart failure, and then it gets even more complicated. Okay, so let's see. This is a cut portion of inside of blood vessel that I've taken up from your heart. Just like there's a blood vessel going to your brain, to your legs, to your pancreas, to your liver, to your arms, and to my hands. And each finger has a blood vessel coming. Similarly, there's also a blood vessel going to the heart, because blood vessel is the only conduit through which nutrition flows in the body. So the heart, it's pumping all the time. It's the fastest, strongest, and heaviest working organ of your body. And it needs constant oxygen supply. It needs constant blood. And if you cut open this normal blood vessel, this is what it looks like. And look like that inside, there's a one line, less reddish, more maroonish line, and this is called endothelium. And this is very close to my heart, because this is the lining that is your lifeline. This is the line that keeps the vessels open or closed. And I'll discuss that in detail with you. So first step that happens really is that, see that little rent in the vessel there? That endothelium is broken. And you see a little yellow spot? That's the beginning of the cholesterol. Now you must wonder, when does this happen? Okay, so you remember, some of you may remember that there was a Vietnam War in the 60s that America went through. And there are a lot of young people that went to the war at that time. And the soldiers in their 18, 19, 20, 21, 22-year-old, they died. When they died, they performed postmortem on everybody, although they died of war injuries, but they needed a postmortem. But when they cut open their arteries, they found out that those 18, 19, 20-year-old had deposition of this yellowish plaque in their arteries. That was an eye-opener. So the blockage really develops in the second decade, third decade of life, and the heart attack happens in the fourth and the fifth decade. Oh my God, so the problem begins way early in life. If the problem begins early in life, the solution should also begin very early in life. So this one line that is inside, I call it endothelium. This secretes a magic hormone, magic substance called nitric oxide. Now, those of you who may have family members that have heart disease have noticed that they must be taking a tablet called nitroglycerin. Whenever they get chest pain, they roll their tongue up, put a nitroglycerin under the tongue, and the pain goes away immediately. What happens? It supplies nitric oxide. Nitric oxide is a substance that dilates the arteries, opens up the arteries immediately. Now, this endothelium is very responsive to what you put inside the blood vessel. Now, Dr. Robert Vogel, professor of cardiology here in Baltimore, University of Maryland, did a very nice experiment. He found out a way of determining the reactivity of the vessel by non-invasive methods in the brachial artery, and he called it brachial artery reactivity. So what he did is he measured the reactivity, saw how the vasomotor tone is, how the artery is expanding or not expanding, and then made these people eat a double cheese hamburger with French fries. Just one time. 30 minutes later, he found out that the reactivity went down. In other words, the endothelium shrunk, the vessel became smaller. Just one meal can change the vasomotor tone, the tone inside the blood vessel. Now think about it. If you are putting in hamburger day in and day out and day in and day out, and the chicken and the cheese and the butter and the fish and the eggs and all this meat, what is happening to inside of these arteries? How much is it shrinking? How much is the endothelium being damaged? And that is where the beginning happens. So those of you who might think that I am knocking down the meat and non-vegetarian, but the vegetarian is okay. Well, we'll talk about in our study, in our IWSPS study, recently published in New England Journal of Medicine, that vegetarian unhealthy diet actually is more harmful than actually a healthy diet with occasional meat. So if you're eating a lot of butter and milk products and cheese, it has the same effect on your blood vessels. So that is where it all begins. Okay, and then you keep bathing your blood vessels in cholesterol. Cholesterol comes from fat, high fatty food. And now see how these yellowish plaques are depositing inside the artery, and it's becoming narrower and narrower and narrower and narrower. In addition to this cholesterol, if you are also leading a lifestyle which is full of inflammation that comes from a diet, inflammation that comes from an inactivity, inflammation that comes from the stress in your mind, in your life, and the inflammation that comes from your unhealthy habits where you put certain substances such as tobacco smoke or alcohol in your body, which is deleterious to your health, that causes oxidation of this cholesterol. When the cholesterol gets oxidized, it causes inflammation inside the artery. So the cholesterol is depositing inside the artery, and now the inflammation is happening inside the artery. When the inflammation happens inside this artery, it gets monocytes, phagocytes, foam cells, interleukin-1, interleukin-6, all these factors that come in and cause ravage inside the artery. And then what happens? This breaks. When this breaks, it forms a blood clot, and the artery is now blocked. So what happened? It all began with cholesterol, which came from an unhealthy lifestyle. It got complemented by inflammation that came from unhealthy lifestyle. And now the inside of the vessel is what? It's Kurukshetra, right? Okay. All right, so there are some factors that predispose you to heart disease. There's some that you cannot change. So look at the top line. It says the risk factors for heart disease that you cannot change. Age, every time you get a year older, your risk of heart attack gets more. Gender, men in general have more heart attack compared to women, and a heart attack comes in men 10 years younger. So a 55-year-old man, if all things being equal, has same risk factor as a 65-year-old woman 10 years earlier. And if there's family history, right? I told you I'm male. My mother, my father, my brother had a heart attack, and I'm getting older every year, right? So these three risk factors I already have. I knew it. I cannot change it, but I don't want a heart attack. Okay. So I checked my blood numbers and I found out I have high cholesterol. I don't have blood pressure, diabetes, and rest of it. So I found out and I said, okay, what is it that I can change? Out of these, mid and the lower limb, only cholesterol belongs to me that I corrected. But if any of these belongs to you, then your risk goes higher. So you should look at it this way. If you have 1 or 2 or 3 of these problems, these 12 risk factors that I'm highlighting here, you're walking towards a heart attack. If you're 4 or 5 or 6, you're jogging towards a heart attack. If you have 7, 8, or 9 of these factors, you're sprinting towards a heart attack. And if you have all 12, you're neither walking, nor jogging, nor sprinting. You're actually sitting. You're sitting on a ticking time bomb. Heart attack will happen. It's only a question when. So you very well know this. Don't worry about writing this down. This will be actually posted on your WhatsApp by Nareshji at the end of the talk. So you will have access to all this. Don't worry about it right now. But just remember, go through this list and see what applies to you. And then determine for yourself, are you walking towards a heart attack? You're jogging towards a heart attack? You're sprinting towards a heart attack? Or you're sitting on a time bomb? When you go to your doctor, make sure that you get these 7 numbers measured and keep a list of that. Now, again, don't try to write this down. All this information will be on WhatsApp for you. What you really need to know is these days, when you get your reports, you see all those arrows. Red arrow pointing up means this thing is high in your blood and it's not good. A green arrow pointing down means it's good and you're fine. So do these numbers and see how many arrows you have in these 7. So if you have 1 or 2 red arrows, right, you're walking towards a heart attack. If you have 3 or 4 of these arrows, you're jogging towards a heart attack. If you have 5 or 6 of these arrows, red pointing up, you are actually sprinting towards a heart attack. And I told you, if you have 7 of these wrong, all red arrows, you're not walking, not jogging, not sitting. You're actually sitting on a ticking time bomb. Okay? So very simple. So the integrated wellness science and practice that we practice and the DASH program that we have, that converts all these 7 up pointing arrows to green down pointing arrows. So if you look at all these from top to bottom and you put my numbers there, you will see green down, green down, green down, green down, green down, green down, green down. But after all this, I still know that I'm walking towards a heart attack. You know why? I told you my family history. I'm male and I'm aging, right? So do what you can change, and what you cannot change, you cannot change. But by just doing this, I know that I can prevent a heart attack, and I have so far prevented heart attack. My brother had a heart attack when he was 43. I'm 65, and still I don't have any symptoms of heart attack. All right, so how does the artery get blocked? I talked about the cholesterol. Cholesterol is a fuel. It is actually what begins the whole process. And cholesterol, you all know, is an animal product. So when I say animal product, please pay very close attention. Eggs, meat, chicken, fish, poultry, they're all animals. Very well, you understand that. One thing that some of you may not understand is the milk, cheese, yogurt, ghee, butter. This also, for the definition of the heart disease, is an animal product. So why do we say animal product? Animal product is the one that supplies you the substance called saturated fat. The saturated fat is what in your liver gets converted to cholesterol. So even when you're eating a diet, extremely healthy, 0 cholesterol, right? 0 cholesterol you can go to. But if you're eating saturated fat, right, you're still supplying the liver material to produce the cholesterol. And 20% cholesterol comes from a diet and 80% is manufactured by your liver. Some cholesterol is good. Your body has to produce it. Cholesterol makes the linings of the cell membranes, some hormones, and all those things. So cholesterol is good, but too much is not good. Inflammation happens when you lead certain lifestyle. When your lifestyle is such, your diet is such, your stress in life is such, it creates inflammation, and that adds the fire to the fuel. And what do you get then? You get the blockage. So you got the gist. The cholesterol is a function of lifestyle. Inflammation is a function of lifestyle. Blockage is a consequence of lifestyle. So what do we need to do? We need to change the lifestyle, as simple as that. Okay, how do you lower your cholesterol? you lower your cholesterol by following this integrated wellness, science, and practice, and also doing this DASH program. Now, over the years, I've seen patients that come in and their blockages, and I've been doing, I told you, angiograms and angioplasties for a good part of 40 years of my previous life. And I have seen all kinds of blockages there. We used to put in balloon, and we used to put in stents. And prior to that, we had atherectomy. We pulverized them with rotational atherectomy. There's so many different technologies we used. And you know what? My patients used to come and joke, and they say, "Oh, doc, do you not have a Drano?" Now, some of you who live in America may know what Drano is. You know how the sinks and the toilets, when they get blocked, there's a very strong chemical that you can drain into that and put like 30, 40 cc's of that syrupy, thick chemical solution, and leave it overnight. And in the morning you flush and everything is clean, because the chemical in the Drano acts on all the debris that is clogging up the sink or the toilet, and it cleans it up and the flow is restored. That's called Drano. Says, "Doc, don't you have some kind of a Drano that you can put in these arteries? And every time I'm going through these stents and angioplasties and balloon and clean it up." Now, obviously this is a joke, a lighthearted joke, right? Well, not. Actually, the diet that we recommend in this program provides the phytochemicals. The diet that we recommend in this program provides the antioxidants. Remember, I told you the LDL that gets oxidized is the one that causes the inflammation and the fire in the artery. If somehow you could prevent oxidation of the LDL by removing those reactive oxygen species from your blood, by taking substances through your diet which are antioxidants, you are actually drinking Drano. So a diet which is rich in phytochemicals, and the diet that we recommend is highly rich in phytochemicals. A diet which is rich in antioxidants actually drains and cleans these arteries. And the very evidence came of this in 1990s when Dr. Esselstyn for the first time picked up 35 patients that had the blockages who were going to go for a stent or a bypass surgery, and said, "You will have none. You will just change your diet." And he put them on this drastic diet, and with diet alone, by performing angiograms before and after, he showed that the blockages in the arteries disappeared. That is how powerful some dietary substances are. That's what is the magic of diet. Now, there is a diet which actually is pro-inflammatory diet. There are substances that you consume in your diet that cause inflammation. You need to stay away from that. There are substances that make the diet anti-inflammatory diet. And I told you 3 of those greatest substances are the phytochemicals, the fiber, and the antioxidants. And that is the diet that we recommend to you. If you maximize that diet, over a period of time, you can clean up these arteries. Obviously, it's not going to happen in a day or so. It takes time. It takes time to change the lifestyle. It takes time to see the benefit. But over a period of time, you restore the health of the endothelium. Just think about what is now going inside that endothelium. It's full of fat and debris. Then that endothelium is shrinking, renting, damaging, depositing cholesterol, adding oxidized cholesterol, increasing the cholesterol plaque, and you're sitting on a time bomb. But if your diet is full of antioxidants and phytochemicals and good fibers, and then you're following other steps that we talk about in this program, then you are moving towards keeping the health of the arteries good. So you lower the cholesterol by following this diet and doing the activities and stress management and habit change that we recommend. It's very important to really understand this, why we have these 4 components. At the bottom is the habit change, but to me, that is the most important, because even if you know, well, right now you could say, I did not know how heart attack happens. I didn't know about risk factors, and here I am. Okay, but now you do. So that excuse is gone. Even after knowing, you'll find out sometimes we end up doing something which we know is not right, but we cannot stop our mind from doing it. And also at other times, we know exactly what is the right thing to do, but we cannot motivate our mind to do what the right thing is to be done. We all go through that all the time. There's this huge procrastination trap Where does this come from? This comes from two components. If the knowledge of the right and the wrong is deeply entrenched in your mind, if that awareness and that discernment is very strong in your mind, and you're very well aware of the consequences of what you're doing, and you follow the scientifically proven methods of habit transformation, you can actually change it. And unless you do that habit change, you understand the science of habit change, it's difficult to change habit. It takes many, many months to change habits. It takes a lifetime to practice a good lifestyle. And it has to be done like that because the benefits that you want from this should be lifetime. Stress. We discussed with you exactly how stress comes in your life and what it does to your body. We're not talking about how to de-stress you in the gym or how to de-stress by taking some concoctions or how to de-stress by watching some movies and how to de-stress by changing your environment outside. No, we're telling you what stress does to your hypothalamus pituitary axis, what stress does to your sympathetic nervous system, what stress does to your parasympathetic nervous system, and how these three combine and coalesce and lead to metabolic syndrome, and how that leads to the lifestyle disorders, high blood pressure, diabetes, cholesterol, heart attack, stroke, chronic kidney disease, certain cancers, and chronic obstructive lung disease. This all percolates from that stress. And how do you prevent that from attacking your body organs and causing metabolic syndrome? That's what we're talking about. We are talking about managing the ravages of the stress on the physiology of your body so that it does not become a pathology in your body. So we talked about how does the artery get blocked. We talked about cholesterol. What about the inflammation? Now, there clearly is a lifestyle which is pro-inflammatory and a lifestyle which is anti-inflammatory, right? Some things you intuitively know. For example, let me give away one: cigarette smoking, right? You know it causes inflammation in the lungs. It's known to you, right? Alcohol, you know, alcohol causes inflammation in the liver, and that is the cause of fatty liver, right? And fatty liver is the one that leads to diabetes. Now you might think that, oh, I drink alcohol, I have no problem from it, I drink every day, I'm functional. Well, you're a functional alcoholic. But this alcohol that you're putting in your liver is causing fatty liver. This fatty liver eventually will lead to problems, including insulin resistance. This will lead to diabetes. Inflammation. And that is just two examples of inflammation I gave you. Sedentary lifestyle, poor sleep, tremendous stress in your mind, they all cause inflammation. The dietary components that you eat, you might think very innocuous, very simple, everyday substances, right? That can cause inflammation. Well, we'll discuss in detail in the diet, but I give away some here now. Processed food, saturated fat, sugar, extra salt, all these combined, all these packaged savories, processed food in cans, bottles, packets, instant eating, fast eating foods, they're all pro-inflammatory. And we'll tell you what anti-inflammatory foods are. Okay, so all this then finally leads to atherosclerosis. But as I told you, along with the cholesterol, which is the fuel, inflammation, which is the fire, there are other factors I told you, like diabetes, blood pressure, cigarette smoking, sedentary lifestyle, poor diet, family history. All these things contribute to blockages. So when you do IWSP and you do this Dash to Wellness program, it is not just controlling your cholesterol or preventing a heart attack. It is also reversing your blood pressure. It's reversing your diabetes. It's treating your obesity. It's reducing your weight. It's improving your fatty liver. It's improving your lungs. It's improving your kidneys. And all these also complement towards protecting you from these blockages. Okay, so that is the reason why we recommend IWSP. So when you do IWSP, you will get the knowledge, which will give you the strength to change, just like this butterfly is changing colors here. And that can happen in 3 weeks. In those 12 lectures, you will get ample information to know what to do and what not to do to prevent a heart attack and lifestyle disorder. But we also have a life component to that. Every 2 weeks, people that attend our program then become part of IWSP Life. And that is where you begin your transformational journey. I remember I told you lifestyle transformation takes a lifetime, and it is for the lifetime. So when you transform, then you see how you transform from a pupa to a larva to a beautiful flying butterfly. Now, I also want to humbly submit to you that ours is not the only program that is available out there. There are many other programs. Now, you understood what you need to do to change your lifestyle and benefit. And please do that. Attend a program that gives you scientifically validated methodologies for change and give you practical demonstrations and hold your hand and take you through for the prevention. You do that program. And make sure, choose a program that gives you at least 3 to 4 weeks of didactic information. It's a lot of information you need. And then every 2 to 3 weeks takes you through that and makes you progress, share with others, connect, learn, experience. Learning and sharing is one most important thing that actually helps you with lifestyle change. So please join our program. If you don't want to join our program, join some other program, but make sure that it fulfills these 2 criteria. It gives you the proper scientific information that you need to change, and then holds your hand and takes you through weeks after weeks on a journey together so that you transform, where you actually connect and improve, where you learn and share. And also, please make sure that you share this information with your friends and family and all those who think can benefit. It helped me, and I want it to help you. I really sincerely want none of you to suffer a heart attack, and I want all of you to enjoy a happy, healthy, wealthy, and worthy life. Thank you. And I'll take some questions now.
Thank you. Thank you, Dr. Sharma, for that wonderful pointer to prevent heart attack. Obviously, as you said very clearly, we are all sitting at various stages, like almost inevitable situations we are dealing. So, but this is the story that it's preventable, and that's why there are a lot of people have joined, and there are a few questions. So I will start asking some of them as we go along. Obviously, the first question is, what is the first aid to be done before patient reaches the hospital? First aid for a heart attack.
911. You immediately call 911. First thing you have to do is pick up the phone and call the ambulance. Before you call anybody, before you call your mama, you call your daddy, your wife, your children, anybody. First thing is try to get the first aid to you as soon as possible, because as I told you, only 50% people reach the hospital. 50% die before reaching the hospital. So what happens? How do they die? They die what is called a sudden death. The typical event is what is called a ventricular fibrillation that occurs in the very early stages of the heart attack. So if you have the EMS there with a defibrillator, if you're having a ventricular fibrillation episode, you have only 3 minutes to live. Within 3 minutes, if you're cardioverted, taken out of that rhythm, back into normal rhythm, you survive. Otherwise, you don't. So if your dad is there, or your cardiologist is there, or your best friend is there, he ain't going to save you. A defibrillator is going to save you. And the defibrillator is with the EMS, the ambulance. So call the ambulance right away.
So in a way, there is no first aid possible at home.
No. And also, please call the ambulance. Just to make it a little lighthearted, a friend of mine told me this little story. He says, I burnt myself. I was in the office sitting, a patient was having a heart attack, and, he was a friend of mine and, very, very dear to me. So I put him in the car in the back and I said, I'll take you to the hospital right away. I only live like 30, my practice is only 200 yards from the hospital. He said, I got to the hospital and I kept telling that guy, come out of the car, come out of the car. And he wasn't coming out of the car. And I looked back and he was dead. Don't do that. Don't take a patient of heart attack to the hospital. Call the ambulance, bring the EMS, because if something can happen in those 5 minutes.
Thank you. Thank you for that real sign and how to handle it. There is a question on why men prone to heart issues more than the women.
Yeah, that's always been an enigma, actually. And to a certain extent, the female hormones provide protection from endothelial injury and damage. And that is why the heart attack incidence is less in women and occurs 10 years later. And mostly up to the time of menopause, they are very well protected. This is the nature. This is divine. You can call it whatever.
Okay. Obviously, there's a question which you explained in the IWSP so well. But the question is, if you can briefly mention, the question is, what is inflammation?
Okay. So let us say this is a finger, right? I'm walking out of here and somehow it just gets trapped in a door. When it gets trapped in a door, you will see what happens there. It becomes red, inflamed, swollen, and it loses its function. So these are the 4 signs of inflammation. Any organ of your body, when it gets inflamed, it gets red, it becomes inflamed, it becomes painful and loses its function. Similarly, if you put a toxin, something damaging in your liver, for example, you put lots and lots of alcohol in your liver, the liver is inflamed. And when it's inflamed, it's red, it's dysfunctional, it's painful. Sometimes in the beginning, it may not be painful. And that is inflammation. What happens is the body's response to deal with an injury. When the injury happens, the body knows that there's going to be dysfunction here, it's hurting. So body sends certain chemicals, body sends certain cells. I told you the phagocytes, the foam cells, the lymphocytes, the monocytes, and then they secrete certain chemicals, interleukin-1, interleukin-6, nuclear factors. So all these happen to make sure that the inflammation, the swelling subsides, the pain gets less. So these are all reparative mechanisms. They are there to protect you. And then you know that after you take some medicines also, this inflammation in the finger is gone, right? So that is called acute inflammation. But what if you keep sticking this finger every day in the door, right? And every day you keep getting injured. Every day, if you keep getting injury, every day you keep getting this inflammation, then this inflammation starts damaging the finger. And then it becomes a chronic inflammation. So same inflammation is good acutely. It's a body's response to heal. Same inflammation, if you keep injuring yourself again and again, then it becomes chronic. And the body's response of healing dies out. And that same inflammation that is going on there right now starts damaging the body organ. So if you keep putting the wrong food in the body one time, the body has a mechanism to repair, right? But if you keep putting wrong food again and again and again, the reparative mechanism, in fact, becomes the opposite. It becomes a damaging mechanism. And that is the inflammation.
Yes, I think very clearly explained in such a short time. Obviously, if you join IWSP, you will hear exactly the mechanism and the steps it goes through and the way to heal them also. It's not the only, you'll know the one side, you'll know the other side, how to handle it.
Actually, as you said, Subrata-ji, of the 12 lectures that we have in this package, you know how inflammation, how close it is to my heart. So I spent actually one full 45 minutes lecture just on inflammation. The lifestyle can be inflammatory, pro-inflammatory, anti-inflammatory. The thoughts can be pro-inflammatory and anti-inflammatory. The habits can be inflammatory and pro-inflammatory. Your sleep and lack of sleep, poor sleep is inflammatory. Inactivity is inflammatory. So we'll discuss all this in detail, how this ties in and reduces inflammation in your body. When you reduce inflammation in your body, that is when you go from illness to wellness. You go from damage to healing.
Yes, thank you. Thank you for the clear-cut understanding and yourself give us the guidelines how to do it. Obviously, IWSP is not only give you the science of it and let you also practice along with all the participants, along with our experts like Dr. Sharma. We have another expert facilitator, Dr. Shiv Kumar. Also, he's a doctor. At the same time, he's a yoga expert. So you'll know how to manage the stress, which you'll know how to prevent inflammation when you can manage your stress. There's one more question coming. I'll just bring that up right now to Dr. Sharma. It is about a medicine called sorbitrate or aspirin. Will it be helpful in case of
Yeah, that sorbitrate is isosorbide dinitrate. It's a slow-acting nitrate. In India, they use sorbitrate instead of nitroglycerin. Nitroglycerin is not available in India. So yeah, this is a medicine that you put under your tongue when you're having chest pain to take care of chest pain. So if you have heart disease and you had a stent or you had bypass surgery, you must always keep those tablets handy. And I tell my patients, you should make a little pocket on your shirt and put one in your pocket all the time, the little bottle. So one should be in your pocket all the time. One should be in your car all the time. One should be in your bathroom all the time. One should be in your bedroom all the time. And one should be in your office all the time. So 5 bottles you must always buy. And they expire after 6 months and you replace them. They're very cheap. They're like $2, $3. They're not expensive. So if you had a stent, you had bypass, you had a heart attack, one in your pocket, one in the glove compartment of your car, one in your bathroom, one in your bedroom, one in your office. So that when you need it, it's rightly available. Because if it hits you, you may not be able to walk to get the nitroglycerin tablet or the sorbitrate tablet. It should be available to you right away. Yes, it's good to keep them if you have had heart attack, stent, or bypass. Otherwise, you don't need it.
Okay, so there's a specific organ inflammation. There is a question on what about inflammation in pancreas?
Same thing. Same principles apply if you are leading a lifestyle which is pro-inflammatory, where you have certain health habits that initiate and propagate inflammation, or you have tremendous stress in your life that is pro-inflammatory, or you're inactive and sleeping poorly, which is pro-inflammatory, or your diet is pro-inflammatory. It's an equal opportunity offender. It's not that inflammation will go in your body and say, okay, I'm going to hit your kidney, I'm going to hit your liver, but I'm not going to hit your pancreas. It hits everything. It hits every organ. So why is it that somebody's pancreas gets damaged and he gets pancreatitis, somebody's liver gets damaged and he gets hepatitis, and somebody's lungs get damaged and he gets the lung disease? It depends upon the resilience of that organ, how strong you are in your body in a particular organ. But as far as inflammation is concerned, it is causing ravage equally in every part of your body.
Yes, that's a very basic thing to know, inflammation. And it affects, and you don't know it. That's the unfortunate part. We don't watch inside. Most of the time we are watching outside, what's happening other side of that. And there is one more question coming, is about cholesterol. What is good cholesterol? What is bad cholesterol?
Yeah. So there are 2 types of cholesterol. The cholesterol are the, as I told you, gets absorbed from the food and also manufactured by the liver. And if you fractionate it, you get 2 different components called low density lipoprotein or high density lipoprotein, LDL and HDL. So one way to remember is LDL is a bad cholesterol and L for low. So you want it low. HDL is good cholesterol. So you want it high, H for high. So increase your HDL, lower your LDL. Now I know the next question is, how do you increase the HDL, right? There is only one proven methodology of increasing HDL, and that is exercise and yoga. If you exercise and you do yoga, your HDL levels go up and it protects you from heart attack. Some people might say that alcohol in moderation increases HDL. No doubt it does, but that should not be the reason for you to go to alcohol if you're not already drinking. And LDL is a bad cholesterol that you should lower. And obviously the IWSP and the DASH is the recipe for lowering LDL and increasing HDL. So if you do IWSP, you don't need to know LDL, HDL, inflammation, heart attack, this, that. All the information that I give you becomes redundant, because why do you need to read about milk or good substances when you're already taking it? So if you're already benefiting from it, right, you don't need to know about all this. So it automatically gets fixed. Once you're doing that program, everything, every inflammation, every disease in every part of your body gets fixed by that lifestyle.
There's a questions. I know one of the parameter you said, the blood pressure. So there's a question, how to reduce blood pressure? Can you have any PPT or some information? Obviously, you have lots of.
Did I just do a talk last week? The last week was on lowering blood pressure, right? I talked. Please go ahead and put that slide again. Those very favorite to me. The American College of Cardiology, American Heart Association recommended 8 practices that lower your blood pressure by 40 millimeters of mercury. Please go ahead and do that. And also put in the last talk that I did. Yes, you can actually reduce, manage, and eliminate high blood pressure without taking medications if you change lifestyle and follow those principles. Absolutely.
Yes, that's very much doable. And you will know how it is.
Oh, there you go. Perfect. Yes.
Exactly.
Please put that on yes. Please put that on WhatsApp. So you don't have to write this down, please. Anybody who is watching this, will make sure that it's available to you on your WhatsApp.
Even
read at your leisure.
Yes. And Facebook Live also, if you can see that, there also you can note down all the components which will help you to.
So think about it. These 8 practices lower your blood pressure by 40 millimeters of mercury. And I told you in the talk, one medicine that you take lowers by 10 to 15 millimeter. So if your blood pressure is 180, right, you need 3 medicines to control blood pressure. But you can bring down from 180 to 140 just by doing these 8 practices. Profound practices, scientifically proven and published in American College of Cardiology, American Heart Association literature. These are not from somebody's figment of imagination. These are actually validated practices.
Yes. I think all the chat box questions I've covered. If anyone else want to say a few things, and I really want to thank Dr. Sharma for spending early mornings in US now and spending time with all of us and clearing the myths and giving a pointer how to handle this heart attack, which are really people are in a pandemic. There's a lot of stress and a lot of myths going around. So in that situation, it's a really good awareness and the indication that we will help you if you join that IWSP program and make you practice also and see how you can be safer and much more stable than going towards a heart attack or any other disease for that matter.
So one last thing I want to say, Subrata-ji, heart attack prevention is very close to my heart, both personally and professionally, as I discussed with you. And I am myself following this to make sure that it doesn't happen to me. And I don't want this to happen to you. So those of you who watched today and learned something, I welcome you all to come and join us in IWSP and benefit. Or if you want to have some other programs that are good for you, please go ahead and do that and join them. But make sure that what you learned today, this link and this information, please share with your friends and family, because to me, the greatest service you can do is also to disseminate this information to prevent heart attack. We don't want that to happen. There is an epidemic of metabolic disorders and lifestyle disorders in India. And we all have to be responsible citizens, and we all have to help each other. And thank you very much.
So also, one point, sir, there is a lot of corporate people are listening to this talk. We also do a lot of programs for corporates. We can do it for your individually, only for your employees alone, short course of, 7 sessions or something like that, customized one. We also do that. So you can be in touch with us. Visit us myiwsp.com. The helpline number is also given in the chat box. Please reach out to us. We'll be more than happy to do this. And it will be very, very, very marginal cost, because just run the program. That's all we do. Thank you, sir. You can go ahead.
Yeah. So I think we have 1 more minute. There is one last question came just now. If you can make people aware, and the question is on alcohol. How much alcohol is safe?
Okay, so this is, there are two ways to look at it. One way to look at it is, what does the science say? Okay, so the science says that 1 to 2 drinks, okay, is called alcohol in moderation. And in some studies that was shown to actually prevent heart attack, in addition to other lifestyle modification measures. But two things you have to understand. Number one, these are Western studies, okay? They're different body shapes and sizes. And then most of the studies were done on Mediterranean people. And you have to understand that Mediterraneans have a very, very healthy lifestyle. Their diet, their activity, their environment, their lifestyle, stress. There's no stress. Beautiful blue sky and the beautiful blue water there, and not much to do there, and living in bliss all day. They have no stress like you and I have. So they take a drink here and a drink there, it's no problem. But that should not be your reason to now start drinking that because the Mediterranean people had less heart attack. And I bring this up now. Please listen to this very carefully. Please pay attention. People listen to something and take one thread out of that and say, I will do this, and the rest of the lifestyle is wrong, and suffer and say, well, I did that and nothing happened to me. Why? No. Lifestyle means comprehensive lifestyle. So in our lifestyle program, there is no room for alcohol, okay? But if you're doing 1 or 2 drinks, that's fine, that's up to you. I tell you why it's important, because somewhere some scientist came along and he said, oh, red wine prevents heart attack. Then he found out, oh, there's a resveratrol in red wine that prevents heart attack. Oh, we can extract red resveratrol and put in a capsule and give it to people to prevent heart attack. It didn't happen. It does not prevent heart attack. So what prevents heart attack is a comprehensive lifestyle transformation. So don't go into shortcuts, this here, that here, this formula from there, this medicine from there, this concoction from here, this herb from here. No, it doesn't work. What really works is a lifestyle transformation.
Yes, thank you very much, Dr. Sharma, for this wonderful presentation and clearing all the doubts we had today. And thank you, all the listeners. Hopefully, you'll know more of it as we go along on 16th of January, where we have that big open event coming up. Please do register, and you will know the whole story. This is just a one story bringing out, make sure you know more of it and the totals, how you can improve your not only heart, but make sure you get well. That wellness has much more many components. That's what we'll talk on 16th of January. Thank you, Dr. Sharma, again, and thank you all the participants. Namaskar. So this, we end the program.